Good evening. Parents are tonight being urged to look for signs of the Strep A infection in their children. The warning comes after the deaths of 6 children in England and Wales from the bacterial infection. It is a common winter virus, but there's been a rise in cases, particularly in children under 10. The Health Security Agency says the vast majority of cases are relatively mild, but families are being advised to seek immediate medical help if they have concerns. Katie Cole reports.
These are 2 of the 6 young children to have died in recent weeks. 4-year-old Mohammed Ibrahim Ali and 7-year-old Hannah Rope. They died from an infection caused by Strep A bacteria. It's found on the skin and throat and typically causes mild symptoms. It can lead to scarlet fever, which is easily treated with antibiotics. In very rare cases, it can be life-threatening and get into the bloodstream. So what should people be looking out for?
Sore throat, temperature, and a fine red rash. It is most common in children under 10 years old.
We saw very little infections during the pandemic, and experts think they've gone up as restrictions on social mixing have lifted. The last time there was a rise in cases was in 2017 and 2018, when there were 4 deaths in the equivalent time frame.
So it is a little bit more, but 4 and 6 is nothing extraordinary. I appreciate that they've all come in around the winter time now. And of course, it raises concern, especially post-COVID. But I really want to also take this opportunity to say to parents, it's got nothing to do with COVID. It's a bacterial infection, more common at this time of the year.
So parents being urged not to panic. The majority of infections are mild and treatable. The message is to be aware of symptoms and, if concerned, seek medical advice. Katie Cole, ITV News.